米国代表講演といたしまして、米国がん協会がんアクションネットワーク CEO のカレン・E.クヌッセン様にご講演いただきます。テーマは、政府の仕組みを変えるがん患者ネットワーク、がん撲滅に向けて動き出した米国と世界です。カレン・E.クヌッセン様の講演は、事前に収録した VTR 映像でご覧いただきます。それではよろしくお願いいたします。
Hello everyone, I'm Dr. Karen Knudsen, CEO of the American Cancer Society and our advocacy affiliate ACS-CAN, standing for the ACS Cancer Action Network. I am so delighted to have been asked to give this opportunity to talk to you about some of our strategies toward eradicating the cancer problem. And what we really hope is that our efforts will have an impact not just nationally, but globally. Since my time of coming in to lead the American Cancer Society, we've divided our efforts into 3 different areas that we think allow us to work at our possible best in the United States to solve for the cancer problem. I'll tell you a little bit more about that, but I'll just give you the overview that those 3 are divided into the following categories. The first is discovery. We know that we must continue to innovate to solve for the cancer problem, funding science across the country, and also leveraging my own scientific teams here at the American Cancer Society. But in the United States, we have some special challenges in those innovations actually getting to people. And that's what the other 2 parts of the American Cancer Society are about. One is advocacy, working with elected officials, both at the federal level, White House down, as well as in each state capital, because here in the United States, many of our healthcare decisions are made by state governments, not the overarching federal government. And we also have the complexity of having many different health systems instead of a single large system across the United States. My third and last strategy is what we call patient support. I think of patient support as solving for the non-biologic reasons that people don't survive cancer. Things like lack of understanding of their disease, gaps in health literacy or digital literacy, or given our geography, an inability just to get a ride to get to cancer care or to have housing somewhere near a cancer center where someone can affordably stay, in our case free when we pay for it, near cancer care. Here in the United States, those are some of the major contributors to cancer mortality. So they may be unique in some level to some of the problems that others may be facing in their home countries, but I'm excited to learn more from all of you. So that's what I call the tripartite strategy: discovery combined with advocacy and direct patient support. So I want to give you a flavor just in a few minutes of what that actually looks like. What I always do try to convey as well is how it is that we prioritize our decision making. We view our organization as existing because we know the burden of cancer is unacceptably high. I know you agree with me on that as well. And as I just mentioned, our strategy is to leverage discovery, advocacy, and patient support to reduce the burden of cancer. And our goal every day is to improve lives of our 2 key stakeholders, cancer patients and their families. But we are also always keeping our eye on what success looks like. And that is ending cancer as we know it for everyone. It's our vision statement and what we think we are driving toward. We're also buoyed by the following, and this really inspires us to continue to push on innovation. And these are data that we collect every year at ACS looking at cancer mortality for men on the left, women on the right, starting in the 1970s when the effort against cancer really got going here in the country. If we had done nothing, the cancer mortality rate would have continued to rise, shown in red. But because of a significant investment in cancer research that started to happen around the beginning of the 1990s by the government, but also the American Cancer Society, we started to see this flattening of the curve of improvements in survival. We are now witnessing, since that time, since that high watermark for cancer mortality rate in the country, a 33% overall reduction in cancer mortality, coming into more than 4.1 million lives saved due to cancer research. So we know we can and must do more. Altogether, since that time, since that high watermark, the American Cancer Society has given almost 15,000 different cancer research grants, totaling more than $3.4 billion. And these are all donor dollars from people who really want to help to solve for the cancer problem. We also consider it our responsibility to educate within the United States, everyone from individuals like me to elected officials about the current state of cancer in America, trends in incidence and mortality. We do also report on the global cancer problem, but not every year. This is a large research study for us. And what we know this year is that we will hit a milestone for the first time of 2 million people in the United States getting a new cancer diagnosis and over 610,000 deaths from disease. So we use this to set priorities for what we should be focusing on. There are trends that are really concerning us right now. We know that there is an unexpected rise in cancer in individuals under the age of 50 at a much higher rate than those above 50, sometimes 2 to 3 times the rate of their predecessors. So clearly something is changing. Colorectal cancer is now the #1 cause of cancer death for people under 50, for men under 50, and the #2 cause of death for women under 50. We also know that screenable cancers are significantly on the rise, and that is something that we can and must do something about. Approximately 65% of Americans are behind on cancer screening. So part of what we are doing is trying to enhance cancer screening rates across the country. So based on what I've told you, I hope you've gathered that we've put the patient and the caregiver at the center of our decision making, and that's a very intentional illustration there. Our goal for programs that we lift up are meant to solve for cancer disparities that are demographic and geographic. So for example, we have a much higher rate of cancer mortality in rural populations in America compared to urban. And so these are some of the things that tell us where we need to place our efforts through discovery, patient support, and advocacy. So I'd like to end by just giving you some summaries into what I think some of those programs are that are the most patient-centric. So in the discovery arm, where we're continuing to fund science, it's not just the funding, it's the reporting out of the cancer trends, which we talked about, but also lifting up programs that are intended to diversify the workforce so that more people have an opportunity in the country to learn what it's like to be at the stage for solving for the cancer problem, to become a scientist, to become a cancer care provider. Because unfortunately, that's on the decline in the United States. We also do science to set cancer screening guidelines so that we can follow the science and then adapt and change so that to relate to the country when is the right time to be screened for cancer. On the patient support side, we're providing free rides to treatment. This is not a small program. Last year, we provided more than 300,000 rides back and forth to care. And where we are, that's so important. You can imagine that if I can go to the chemotherapy center 5 days a week to get cancer therapy, but someone else, my neighbor, can only go 3 days a week because they don't have a ride, who is going to have the better outcome? And that's a reality here in the United States. It's something we have to solve for. And again, as I mentioned, providing housing near cancer centers. We also have a 24/7 hotline and all up-to-date cancer information written at a level that anyone can understand at cancer.org. Cancer.org alone gets 50 million unique users every year. It is used globally as an objective single book of truth to learn more about cancer. We also fund patient navigators across the country. Patient navigators help people understand their care and get to their care, and we help train those navigators. On the advocacy side, we are working with elected officials to ensure that smoking cessation is taken up across the country, to ensure that more people have health care insurance that can cover cancer care, and also ensure that they have access to things like biomarker testing so that if someone is diagnosed, for example, with breast cancer, that they have an opportunity to know if their tumor could be treated with a HER2-directed therapeutic. Believe it or not, in many states, that kind of testing was not being covered. So we have to work with elected officials to make sure they understand how important that is. I also wanted to spend a minute talking about patient navigation because this is so key. Patients who well, for the first time this year, have access to navigation because we worked with the White House on ensuring that patient navigators became a reimbursable component of cancer care, for the first time really being part of the care team. And this was critical because patients who are navigated understand their care, they complete their care as planned, they have a better outcome because they're getting to all their appointments and they are understanding what they have to do when, and they also have a lower cost of care. So everyone wins when there's a patient navigator. So we are helping to train this new workforce of people around the country of how to do it. We're very excited about that. This was one of our major advocacy wins to ensure that more people had access to a patient navigator. This navigation training, you can go and have a look if you would like. It's called LION, for Leadership in Oncology Navigation, and a very important component of what it is that we now do at the American Cancer Society. So thank you so much for listening to what it is that we do here at ACS. It is the case that we do consider ourselves as constantly in adjustment to devote our resources toward the priorities that can make the most difference. But we also know that we can't do it alone. So working with other organizations, like organizations across the world, is what we'd like to do more of. So I encourage you to reach out to us so that together we can end cancer as we know it for everyone. Thank you, everyone.
クヌッセン様のご講演でした。ありがとうございました。